Welcome to the Vox Herald podcast, hosted by me, San Juan. Today, we're diving into a story that's not just about one small town in British Columbia, but about a much larger issue affecting Canadians from coast to coast: access to healthcare in rural communities. In Dawson Creek, a northern community of about 17,000 people, the only obstetrician-gynecologist left this spring, leaving pregnant patients without local specialized care. For 9 weeks, residents needing higher-risk pregnancy services have had to travel an hour north to Fort St. John. This isn't just a local inconvenience, it's a symptom of a broader healthcare crisis in Canada, one that hits rural areas hardest. An exam room in the Chickadee Maternity Clinic, located inside the newly renovated Rimrock Health Center in Dawson Creek, Chickadee Maternity Collaborative here in New Brunswick. We know this struggle all too well. Whether it's a family in Miramichi waiting weeks for a doctor's appointment or an Indigenous community in Tobique First Nation facing barriers to basic care, the challenges of accessing healthcare in rural and remote areas are deeply felt. This story from Dawson Creek, reported by CBC News, shines a light on the urgent need to address healthcare shortages, particularly for specialized services like obstetrics and gynecology. It's a story about people, mothers, families, and healthcare workers caught in a system stretched to its limits. So, folks, what does it mean when a small town loses its only specialist? How does this ripple out to affect families, communities, and even the healthcare workers trying to fill the gap? And what can Health Canada, provincial governments, and local communities do to fix this? Today, we'll unpack the Dawson Creek crises, explore its roots in Canada's healthcare system, and connect it to the challenges we face right here in New Brunswick. We'll hear from healthcare providers, patients, policymakers, and researchers, and we'll ask, how do we ensure equitable access to care for every Canadian, no matter where they live? Let's get started. To understand why Dawson Creek is without an Ob-Gyn, we need to step back and look at the broader picture of Canada's healthcare system, particularly in rural and remote areas. Canada's universal healthcare system, governed by the Canada Health Act of 1984, promises accessible care for all. But for decades, rural communities have faced persistent shortages of healthcare providers, from family doctors to specialists like obstetricians. This isn't a new problem, it's a chronic one, rooted in geography, demographics, and systemic challenges. Since the 1960s, Canada's healthcare system has grappled with uneven distribution of medical professionals. Urban centers like Toronto, Vancouver, and Montreal have historically attracted more doctors and specialists due to better infrastructure, higher salaries, and lifestyle amenities. Meanwhile, rural areas, including Dawson Creek and parts of New Brunswick like Restigouche County, struggle to recruit and retain providers. A 1971 report by the Canadian Medical Association noted that rural communities often relied on a single doctor or nurse to serve thousands, a pattern that persists today. In British Columbia, the Northern Health Authority, which oversees Dawson Creek, has faced chronic shortages. A 2017 Auditor General report highlighted a 15% vacancy rate for registered nurses in Northern Health, with similar gaps for specialists. Nationally, a 2022 report from the C.D. Howe Institute estimated a shortage of 60,000 nurses and projected a deficit of 78,000 doctors by 2031. Obstetrics and gynecology, requiring years of specialized training, is particularly hard hit. The Royal College of Physicians and Surgeons of Canada reported in 2020 that rural areas often lack the patient volume to sustain full-time specialists. Yet the demand for emergency services like C-sections creates intense pressure on those who remain. Health Canada has played a role in addressing these shortages through funding and policy. In the 1990s, the federal government launched the National Health Service Corps, inspired by a U.S. model, to incentivize doctors to work in underserved areas with loan forgiveness. In British Columbia, the Rural Retention Program, introduced in 2001, offers financial incentives for doctors and nurses in remote areas like Dawson Creek. Yet, these programs have had mixed success. A 2020 review by the Society of Rural Physicians of Canada found little progress in retaining specialists, citing burnout and lack of support as key barriers. In New Brunswick, rural healthcare challenges mirror those in British Columbia. The province's 2023 health plan acknowledged that 20% of New Brunswickers, roughly 160,000 people, lack a family doctor, with rural areas like Kent County and the Acadian Peninsula particularly affected. Indigenous communities, such as First Nation, face additional barriers, including cultural insensitivity and limited access to specialists. A 2024 report from the New Brunswick Medical Society highlighted that rural hospitals, like those in Campbellton, often face temporary closures due to staffing shortages. Echoing Dawson Creek's predicament, Health Canada's role in rural healthcare is primarily supportive, providing funding through the Canada Health Transfer (CHT), which allocates billions annually to provinces for healthcare delivery. In 2023, the federal government committed an additional $200 billion over 10 years to strengthen healthcare, including rural access. However, provinces like British Columbia and New Brunswick manage their own health systems, leading to variations in how funds are used. Health Canada also supports initiatives like the Foreign Credential Recognition Program, FCRP, which helps internationally trained professionals, including Ob-Gyns, enter the workforce. Yet, bureaucratic hurdles often delay integration, exacerbating shortages. Obstetrics and gynecology in rural areas is particularly vulnerable. Pregnancy care requires a continuum of services, from prenatal checkups to emergency C-sections. In small communities, family physicians and midwives often handle low-risk pregnancies, but higher-risk cases need specialists. When Dawson Creek's Ob-Gyn left, the Chickadee Clinic, staffed by nurses and midwives, became the primary option for routine care. However, without a local specialist, patients face long drives or transfers, increasing risks for complications. This issue isn't unique to Dawson Creek. In New Brunswick, rural hospitals like those in Caracat have faced similar gaps in obstetrics, forcing patients to travel to Moncton. A 2019 study by the Canadian Institute for Health Information found that rural maternity units are closing at an alarming rate, with 20% of rural Canadian hospitals ceasing obstetric services between 2000 and 2015. Several factors contribute to these shortages. First, Canada's aging workforce is a significant driver. Many doctors and nurses are nearing retirement, and training programs haven't kept pace. Second, rural practice is demanding, with long hours and limited support. Third, disparities in pay and resources discourage young professionals from choosing rural careers. Finally, global competition for healthcare workers, intensified by the COVID-19 pandemic, has made recruitment harder. The departure of Dawson Creek's only Ob-Gyn is a microcosm of Canada's rural healthcare crisis. Let's break down the mechanics of this issue, its immediate impacts, and the broader implications for healthcare access. Dawson Creek, a community of 17,000 in British Columbia's Peace River region, relies on the Dawson Creek and District Hospital for healthcare. The hospital's obstetrics program, supported by one Ob-Gyn, serves not only Dawson Creek but surrounding areas. When the most recent Ob-Gyn, who arrived in July 2024, left in spring 2025, the community was left without specialized care for high-risk pregnancies. Northern Health, the regional authority, is actively recruiting to fill the vacancy, but as of July 2025, no permanent replacement has been found. For low-risk pregnancies, the Chickadee Clinic offers support from nurses, midwives, and family doctors. However, high-risk patients, those with conditions like preeclampsia or gestational diabetes, must travel to Fort St. John, an hour away. This distance, while manageable for some, poses significant risks. Poor weather, common in northern BC, can make roads treacherous, and delays in care can lead to complications. A 2023 study by UBC's Centre for Rural Health research found that rural patients face a 30% higher risk of adverse outcomes during pregnancy due to limited access to specialists. Why is it so hard to keep an Ob-Gyn in Dawson Creek? The answer lies in a combination of structural, professional, and personal factors. Obstetrics is a high-stakes specialty, requiring constant availability for emergencies like preterm labor or hemorrhaging. In rural settings, a single Ob-Gyn often works, without backup, leading to burnout. Jude Cornelson, co-director of UBC's Center for Rural Health Research, notes that solo practitioners are on call pretty much all the time, making the role unsustainable. Additionally, rural communities often lack the patient volume to justify a full-time specialist. Dawson Creek's population of 17,000 generates fewer higher-risk pregnancies than urban centers, meaning an Ob-Gyn may not have enough work to maintain a viable practice. Conversely, when demand spikes, the workload becomes overwhelming. This paradox: too little work to sustain a practice, yet too much to avoid burnout, is a key driver of turnover. Northern Health's recruitment efforts include job postings for Ob-Gyns in Dawson Creek and Fort St. John, as well as a rural locum program that brings temporary specialists to communities. However, locums are a short-term fix, and permanent recruitment is challenging. The province's recent campaign to attract U.S. doctors and nurses, launched in June 2025, has seen nearly 1,600 professionals express interest, including 704 doctors. Yet, integrating these professionals requires navigating licensing barriers, which can take months. The absence of an Ob-Gyn in Dawson Creek has immediate consequences. Pregnant patients face increased stress and financial burdens from traveling for care. For low-income families, or those without reliable transportation, this can mean delayed or foregone care, increasing risks for both mother and baby. Northern Health's Chickadee Clinic provides a safety net, but midwives and family doctors aren't trained to handle complex cases. Emergency transfers to Fort St. John, or even Prince George, 4 hours away, add further strain. Healthcare workers are also affected. Nurses and midwives at the Chickadee Clinic face increased pressure to manage cases outside their expertise, contributing to stress and burnout. A 2023 report from the BC Nurses Union noted that staffing shortages in Northern Health have led to moral distress among nurses who feel unable to provide adequate care. The Dawson Creek crisis reflects broader systemic issues. First, Canada's medical training pipeline produces too few specialists for rural needs. The University of British Columbia's medical program, while expanding, struggles to train enough Ob-Gyns willing to practice rurally. Second, retention is a major challenge. Financial incentives like Northern Health's $8,000 annual retention bonuses help but don't address deeper issues like isolation or lack of support. Third, Canada's reliance on internationally educated professionals is hampered by slow credential recognition. Despite recent reforms. In New Brunswick, the situation is strikingly similar. Rural hospitals like those in Bathurst and Miramichi often lack specialists, forcing patients to travel to urban centers. A 2024 report from the New Brunswick Health Council found that 30% of rural residents had to travel over an hour for specialized care, compared to 10% in urban areas. Indigenous communities, such as Ob-Gyn, First Nation, face additional barriers, including systemic racism and underfunded health services. The province's 2023 health plan aims to address these gaps through team-based care models, but progress is slow. Health Canada's involvement is indirect, but critical. Through the CHT, it provides funding to provinces, which allocate resources to rural health. Health Canada invested $47 million in health workforce research, including projects to improve rural recruitment. The FCRP, with $50 million allocated in 2024, supports internationally trained professionals, but its impact in rural areas remains limited. Health Canada could play a stronger role by streamlining credential recognition and funding rural training programs, but provinces ultimately control delivery. To fully understand the Dawson Creek crisis, let's hear from the key players: patients, healthcare providers, policymakers, and researchers. Each offers a unique perspective on the problem and potential solutions. For pregnant patients in Dawson Creek, the loss of an Ob-Gyn is deeply personal. Take Sarah, a hypothetical Dawson Creek resident, based on typical patient experiences. At 32 weeks pregnant with her second child, Sarah was diagnosed with gestational diabetes, requiring specialist care. Without a local OB-GYN, she must drive to Fort St. John for appointments, a trip that costs time, money, and emotional energy. It's stressful, she might say. What if I go into labor early? Will I make it to Fort St. John in time? For Indigenous patients, the challenges are even greater. Many in nearby communities, like West Moberly First Nation, face cultural barriers and distrust of the healthcare system, compounded by travel requirements. In New Brunswick, similar stories abound. A 2024 CBC report highlighted a mother in Restigouche who drove 2 hours to Moncton for prenatal care due to a lack of local specialists. Patient advocacy groups, like the BC Health Coalition, argue that rural healthcare shortages violate the Canada Health Act's principle of accessibility. They call for more funding for rural hospitals and better transportation support for patients. Doctors, nurses, and midwives on the front lines face immense pressure. Dr. Emily Chen, a family physician at the Chickadee Clinic, a composite based on real-world accounts, explains, "We can handle routine pregnancies, but without an OB-GYN we're stretched thin. If something goes wrong, we have to transfer patients, and that's nerve-wracking." Nurses echo this sentiment. The BC Nurses Union reports that staffing shortages in Northern Health have led to unsafe working conditions, with nurses working back-to-back shifts. In New Brunswick, the New Brunswick Medical Society highlights similar concerns. Rural doctors often work without adequate support, leading to burnout. A 2023 survey found that 40% of rural physicians in the province planned to retire or relocate within 5 years. Midwives, while critical, are also in short supply. The Association of New Brunswick Midwives notes that only 20 midwives serve the entire province, limiting their ability to fill gaps left by Ob-Gyns. British Columbia's Health Minister, Josie Osborne, acknowledges the crisis but points to recent efforts. The province's 2025 campaign to recruit U.S. doctors and nurses has streamlined licensing for American-trained professionals, with nearly 1,600 expressing interest. "We're seizing the opportunity to attract talent," Osborne said, emphasizing rural needs. However, critics argue that recruitment alone isn't enough without retention strategies. In New Brunswick, Health Minister Bruce Fitch has prioritized team-based care, with pilot projects in Fredericton and Moncton integrating family doctors, nurses, and allied health professionals. Yet, rural areas like Dawson Creek and Miramichi see slower progress. Health Canada, through its CHT funding, supports these efforts, but faces criticism for not targeting rural shortages specifically. The Canadian Medical Association argues that federal funding should prioritize rural training and retention programs. Jude Cornelson from UBC's Center for Rural Health Research emphasizes the need for team-based care and infrastructure investment. One Ob-Gyn can't do it all, she says. We need family doctors with enhanced surgical skills and robust locum programs to give providers breaks. She also advocates for better data on rural healthcare needs to guide policy. In New Brunswick, researchers like Dr. Shelley Doucette at the University of New Brunswick stress the importance of culturally safe care for Indigenous and Acadian communities, which requires more than just hiring doctors. The BC Nurses Union and the Canadian Federation of Nurses Unions argue that systemic underfunding and poor working conditions drive shortages. Nurses are burning out, says BCNU President Aman Gruel. We need better ratios and support. In New Brunswick, the New Brunswick Health Coalition calls for community health centers to provide integrated care, similar to the BC Greens Dogwood model. In New Brunswick, the Dawson Creek crisis resonates deeply. Rural communities like Miramichi and Bathurst face similar shortages of specialists, including Ob-Gyns. A 2024 report from the New Brunswick Health Council found that 25% of rural residents lack access to timely maternity care, compared to 10% in urban areas. Indigenous communities, such as Red Bank First Nation, face additional barriers, including underfunded health centers and cultural insensitivity. Acadian communities, concentrated in the Northeast, also struggle with language barriers, as many providers don't speak French. The province's 2023 health plan aims to address these gaps through team-based care and recruitment incentives, but progress is uneven. For example, the Miramichi Regional Hospital has faced temporary maternity unit closures due to staffing shortages, forcing patients to travel to Monk. These closures echo Dawson Creek's reliance on Fort St. John, highlighting a national pattern of rural healthcare disparities. Nationally, Canada faces a healthcare workforce crisis. A 2022 report estimated a shortage of 60,000 nurses and projected a deficit of 78,000 doctors by 2031. Rural areas bear the brunt, with 91% of rural counties facing primary care shortages. In British Columbia, Northern Health's 15% nursing vacancy rate is among the highest in the country. Other provinces, like Newfoundland and Labrador, report similar challenges, with some communities lacking family doctors for years. Health Canada's response includes funding through the CHT and programs like the FCRP, which supported 6,600 internationally educated professionals in 2023 to 2024. However, provinces control how these funds are used, leading to inconsistencies. British Columbia's U.S. recruitment campaign, launched in 2025, is a bold move, but its success depends on retention and integration. Globally, rural healthcare shortages are not unique to Canada. In the U.S., 91% of rural counties face primary care shortages, similar to Canada's challenges. The U.S. National Health Service Corps offers loan forgiveness to rural providers, a model Canada has adopted but underutilized. Australia's rural health workforce strategy includes incentives like housing support, which British Columbia and New Brunswick could emulate. The European Medicines Agency IMA has no direct equivalent to Health Canada's rural focus, but its streamlined licensing for foreign professionals could inform Canadian policy. If left unaddressed, the Dawson Creek crisis could have lasting impacts. Rural communities may see declining birth rates as families relocate to urban areas for care. Healthcare disparities could widen, particularly for Indigenous and low-income populations. Burnout among remaining providers risks further turnover, creating a vicious cycle. In New Brunswick, continued shortages could strain urban hospitals as rural patients seek care, increasing wait times and costs. Nationally, the projected shortage of 78,000 doctors and 117,600 nurses by 2030 threatens the sustainability of universal health care. Without intervention, rural maternity units may close entirely, as seen in 20% of rural Canadian hospitals between 2000 and 2015. This could erode public trust in the healthcare system, fueling calls for privatization, as proposed by the BC Conservatives. Solutions and policy considerations. Strengthen team-based care. Health authorities should invest in interdisciplinary teams, combining family doctors, midwives, nurses, and specialists. In New Brunswick, pilot projects in Fredericton show promise, but rural expansion is needed. British Columbia's Go Health BC program, which deploys travel nurses to rural areas, could be scaled up. Enhance rural training. Universities like UBC and the University of New Brunswick should expand programs for rural medicine, including obstetrics. Training family doctors in enhanced surgical skills, like C-sections, can reduce reliance on specialists. Streamline credential recognition. Health Canada's FCRP should prioritize rural needs, fast-tracking Ob-Gyns and other specialists. British Columbia's 2025 reforms, which allow US-trained doctors to practice without additional exams, are a step forward. Improve retention. Financial incentives, like Northern Health's $8,000 bonuses, are insufficient without addressing burnout. Rural providers need better support, including locum programs and mental health resources. Invest in infrastructure. Rural hospitals need modern equipment and facilities to attract providers. In New Brunswick, upgrading hospitals in Miramichi and Bathurst could draw specialists. Community engagement, involving local communities, especially Indigenous and Acadian groups, in recruitment and retention strategies can build trust and cultural safety. Health Canada could lead by increasing targeted funding for rural healthcare through the CHT and expanding programs like the FCRP. Collaborating with provinces to standardize credential recognition and support rural training would also help. However, solutions must respect provincial autonomy while addressing national disparities. The loss of Dawson Creek's only Ob-Gyn is a stark reminder of the challenges facing Canada's rural healthcare system. From British Columbia to New Brunswick, rural communities are struggling to access the care they need, particularly for specialized services like obstetrics. This crisis isn't just about one doctor. It's about systemic issues, an aging workforce, urban-rural disparities, and slow integration of international professionals. For patients like Sarah in Dawson Creek, or families in Miramichi, these shortages mean real risks and hardships. Folks, this issue hits home for all of us. Whether you're in Moncton or a small town like Sussex, access to healthcare is a right, not a privilege. Health Canada, provincial governments, and local communities must work together to strengthen rural care. That means investing in training, supporting providers, and building infrastructure that makes rural practice sustainable. Have you faced challenges accessing healthcare in New Brunswick? Share your story on X-Weed. Love to hear from you. As we wrap up, let's remember, without healthcare workers, there is no healthcare. Let's keep pushing for solutions that ensure every Canadian, no matter where they live, gets the care they deserve. In related news, Health Canada announced on July 1, 2025, an additional $10 million for the Foreign Credential Recognition Program, targeting rural healthcare shortages. This funding will support 1,000 internationally educated professionals, including Ob-Gyns, to enter Canada's workforce by 2026. The initiative builds on British Columbia's success in streamlining licensing for U.S.-trained doctors and nurses, a model that New Brunswick is now exploring. Health Canada also issued a call for provinces to submit rural healthcare plans by December 2025 to access targeted CHT funds. This update underscores the federal government's commitment to addressing rural shortages, but as we've seen in Dawson Creek, implementation is key. Stay tuned for more updates, and check Health Canada's website for resources on accessing care in your community.